It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following: neutering your male dog, and what you should know. There are many myths surrounding neutering male dogs, and you should take the time to learn the facts before making a decision about the procedure. Here are some things you should know about neutering your male dog. 1. Basic concepts of castration surgery. The surgery is even simpler than sterilization. A veterinarian anesthetizes the dog, makes an incision in front of the scrotum, cuts the stalks of the testicles, and then removes the testicles through the incision. The incision usually needs stitches, and the dog will likely need an Elizabethan collar during recovery to prevent it from licking the area. After about 2 weeks, the incision heals completely and the dog can continue to live a normal, healthy life. 2. The benefits of neutering your dog. Of course, the main benefit is that you won't sire any puppies. Hundreds of thousands of dogs are euthanized in shelters each year due to overpopulation, so neutering is extremely important. But that is not the only benefit of castration. Here I tell you some more reasons to neuter your dog. He is less likely to get certain diseases, such as testicular cancer and most prostate diseases. He will probably be calmer with less testosterone in his system. He will score less in and out, since he has less incentive to announce his presence. Lower testosterone can improve, if not eliminate, laziness, aggression, sexism, and other dominance-related behaviors. He may still want to fuck, but mounting after neutering has more to do with dominance than reproduction. He may also show interest in females in heat. He is likely to fight less with other dogs, especially other males. For older dogs, neutering reduces the size of the enlarged prostate. 3. When to neuter your dog. A male dog can be neutered anytime after 8 weeks of age. Veterinarians used to recommend waiting until he hit puberty, around 6 months, and some still make that recommendation. Talk to your veterinarian about what is best for your dog. In general, dogs neutered before puberty grow a little more than those neutered after puberty because testosterone is involved in bone growth. Dogs neutered in adulthood have a slightly higher risk of complications from surgery, as do dogs that are overweight or in poor health. 4. What to expect after surgery. Neutering surgery is usually simple and straightforward. Your vet will give you instructions for postoperative care, and your dog will likely make a full recovery within a couple of weeks. Here are some things you can expect after neutering your dog. Male dogs can usually go home the same day as the procedure. The dog may have some nausea and refuse food for the first 2 days. It is not necessary to force your dog to eat. You will be fine even if you skip some meals. For the first few days after surgery, the dog's scrotum will be swollen. Often this swelling is aggravated if the dog licks the incision. If he continues to lick the spots, place an Elizabethan collar around his neck. If your vet used stitches, they will likely need to be removed after about 7 to 10 days, depending on the type of stitching material used. Some modern stitches fall off on their own after a certain time. After neutering, a puppy's scrotum will flatten as he grows and you will not notice it. Adults will always have an empty scrotal skin flap. Typically, most dogs want to play a lot the next day, but restrict your dog's activity for a couple of days so the incision doesn't open up. Some minor bruising may appear around the incision. 5. Things to keep in mind after surgery. Consult your veterinarian if there is discharge from the incision or if your dog appears to be in excessive pain. It is rare for a dog to need pain medication, but it is not unheard of. If the dog continues to lick the spots, use an Elizabethan collar to prevent this. Some dogs have trouble walking while wearing them and bump into doors and tables. However, have the dog wear it even while sleeping, because licking can prevent the incision from healing properly. Call your veterinarian if you see any unusual symptoms or changes that worry you. You may notice immediately after surgery that your dog is not his usual self. He may feel lethargic or have low energy. Give him some time to recover before you start to worry. The neutering procedure may make your dog calmer overall, but dogs, for the most part, tend to return to their normal personality after recovery. However, some dogs are more affected than others, so talk to your vet if you are concerned. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend, a hug and until the next video.